Thank you, Dr. Pallavi, and all those participants in this session. Good morning, good afternoon, good evening. Welcome to 1646th day of continuous and uninterrupted Zoom session of IFPH. Let us start today's program with a silent prayer for 1 minute. Thank you and welcome back. Today we have with us Dr. KULWANT SINGH, MD Homeopathy, ex-Dean Faculty Homeopathy, Vinoba Bhave University, Hazaribagh, Jharkhand, Principal, SHM College, Jamshedpur, present several seminars in and outside India, Arab Health Congress, Dubai 2014. And today's topic is rheumatic fever, heart, and its homeopathic management. On behalf of IFPH and Dr. KULWANT SINGH, you can have the platform for the next 45 minutes. It's over to you, sir. Please proceed, sir. Yes, audible as well as visible, sir. Please.
Thank you. I thank all the IFPH members for giving me a chance to speak on this beautiful subject. So this is not a very common disease, but very important disease for the point of view of understanding this problem. So this is related with rheumatism, heart, and so many other things. And when found, it is very important to diagnose a case properly. If we can't diagnose this case, it will be difficult to treat this case because this case is not very common. So let us start. Let us try to understand rheumatic fever and rheumatic heart. The word rheumatism means pain in the joint, swelling in the joint. In this case, surprisingly, this disease starts from the throat. And then the other symptoms develop, and one of them is joint pain and fever. But it starts from the throat, and it starts from an infection which is known as post-streptococcal infection caused by group of A beta hemolytic streptococci. There are streptococcus we know very well, and this is caused by, this is a group A. There is Dr. Lansfield group notification for streptococcus. So it belongs to group A beta hemolytic group of streptococcus. And it occurs usually after an attack of pharyngitis. You will be getting so many cases when the child is getting regular pharyngitis. Regular mother will come, parent will come and complain to you or explain to you that this child is getting recurrent throat infections. We give antibiotic, the child gets better. Then again, after a few weeks, he gets throat infection. We again give the same process, and gradually the child develops the complications of strep throat. This post-streptococcal infection complications, if it is a case of rheumatic fever, then if the child is not treated properly, the thing is that when the child, it is a disease of this group, mostly from 5 to 15 years. Male and female are equally affected and can also occur at any age. This is very rare. Mostly it is a disease of the child between 5 to 15 years of age. This is Streptococcus pyogenes is beta hemolytic and cause bacterial pharyngitis. I told you that this causes pharyngitis, and they are known as flesh-eating bacteria and cause life-threatening disease. There is a saying that this infection licks the joint but eats the heart. A very common phrase. This infection licks the joint but eats the heart. How and why we will study later. This is a normal throat, we can see. This is a normal throat, and this is the infected throat. Bacterial streptococcal infection. You can see this. These are the outer signs when it is clear that this child is infected with strep throat. So what happens actually? In case of streptococcal infection, a child gets an infection, gets treated by antibiotics or any other medicine, gets cured, the fever is gone, there is no other complication. But why we are afraid of these things? This streptococci, what happens? Now we try to understand actually what happens, why we are afraid of this kind of a complication. So the streptococcus contain antigens. To these antigens, antibodies are formed in the body. This is a normal process. Whenever there is infection, there will be formation of antibody. That antibody will go to the site of infection, fight with the infection, kill the bacteria, and the patient gets all right. This is a normal procedure which is followed in cases of infection. But what happens in this case? I told there is infection. That infection sends a signal to the brain or the immune system. There are formation of antibodies, and these antibodies come to fight with the infection. In general, in 97 to 98% of cases, this happens. That there is formation of antibody, it goes to the site of infection, it fights the infection becomes all right. The child becomes all right. But in 2 to 3% of cases, the case is different. And that is where rheumatic fever comes. What happens to 2 to 3% of cases? These antibodies are searching streptococci but find none there, because the patient has taken some medicines. So these medicines have already killed the bacteria, but the antibodies have been formed. So what happens? The antibody search for the streptococcus. And this streptococcus in its cell wall contains a protein which is known as M protein. Please remember this. This M protein is the protein in the antibody present in the cell wall of the streptococcal infection. The streptococcal bacteria contains M protein in the cell wall. So this M protein, fortunately or unfortunately, is present in some organs in the system. So when these antibodies go to fight the streptococcal infection, there are 2 or 3% of cases when they go, they do not recognize properly and they start fighting with the organs which also contain M protein. Which are the organs which contain M protein in their cell wall? We will come to that. See, there is an infection in the throat. This infection sends a signal to the immune center. This is the immune center in the system, imaginary. So this is the immune center. In the immune center, the body sends a message. It calls for help. It calls for help to the immune system. The immune headquarters, it sends antibodies. This is sending antibody to the site of infection, and the infection gets cured. This is a normal procedure in 96 to 97% of cases. But in the remaining 2 to 3% of cases, what happens is strange phenomena. There are 5 parts in the body which contains M protein in their cell wall. There are 5 parts in the system which contain M protein in the cell wall. So unfortunately, this antibody attacks these 5 organs and cause or create so many symptoms in the body. So one is when it works on the central nervous system. It acts on the brain. So while acting on the brain, there are some disturbance due to this antibody. The toxins or cytokines secreted from the antibodies. So they disturb the motor reflexes which are coming out from the brain. When these motor reflexes are disturbed, so there are involuntary jerky movements in the system, body. So these involuntary jerking are known as chorea. Involuntary jerking, you can see this child, there is involuntary jerk. Nothing is under his control. So that involuntary jerk is taken as chorea. This is known as chorea. The second organ is the joint, synovial joint. All the synovial joints are affected by this, and it causes pain, swelling, temperature, stiffness, severe pain. In case of rheumatic heart, the pain is very severe, rheumatic fever. Third is formation of nodules. It acts tissues, connective tissues, which are below the skin. So when it is below the skin, there are connective tissues. It acts on them, produces nodules, especially on the extensor surfaces, like this on the back. So it produces some nodules like this on the skin. It acts on the skin, produces red rashes. This is known as erythema. This comes in the margin. There are some margins, so it is known as erythema marginatum. And the most important part, why it is known as rheumatic heart, because it acts very profoundly on heart. And surprising thing is that when you will study a case of rheumatic fever, these 4 symptoms, they subside after the attack. If child gets an attack of streptococcal infection, the streptococcal infection gets normal, there is no fever, there is no complaint, but after 3 to 4 weeks, as the antibody is there in the system and it has already affecting the different system, so these symptoms are coming up. But after some days or some weeks, all these symptoms are cured. They do not exist, these 4 symptoms. But the action on heart, the damage on the heart tissues, cardiac tissues, it remains for long. And if the attacks are repeated regularly, there are chances of serious damage to the heart. So this is rheumatic fever. As I described, it acts on brain, causing neurological effects, and these neurological effects are Sydenham chorea. The chorea symptoms, the involuntary jerking symptoms, they are known as Sydenham chorea. We will come to that later on. It acts on heart, and in case of heart, it produces cardiac issues, valvular damages, congestive cardiac failure. These are the complications of cardiac complication in case of rheumatic heart. Third is arthritic symptoms. I told you that it acts on synovial joints, and the pain is migrating. The patient will come, parent will come, guardian will come, this child was having fever and it started joint pain in the knee joint. It got all right, but after 4 weeks, 5 weeks, it has again started the pain in the ankle joint, sometimes in the elbow joint. So all the synovial joints are affected, and there is swelling, there is pain, there is temperature, there is stiffness. These 4 are the cardinal signs when it is a case of rheumatic fever. It acts on skin, which I told you, distinctive rashes, erythema nodosum. Actually, it is erythema not nodosum, erythema marginatum. And in case of subcutaneous tissues, it acts subcutaneous nodules and severe inflammation. And as I told you, there is a saying that it licks the joint but eats the throat, because joints get cured. It acts on the joint, gives you a lot of trouble. There is severe pain in the joint. Intolerable pains are present in the joint, but gradually they become normal. After medication, without medication, they become normal. That is why they say it licks the joint, but eats the heart. The most serious complications are on heart. What are the complications on heart? See, there are 3 layers in the heart. All we know, the outermost layer is known as pericardium, the middle layer is known as myocardium, and the innermost layer is known as the endocardium. So it acts on pericardium. It causes inflammation of pericardium. This condition is known as pericarditis. We will come to that. But in general, there is inflammation of pericardium. It causes pericarditis, and due to pericardium inflammation, there is chest pain. There is severe chest pain, like angina pectoris, but there are differences between angina pectoris and the pericardial or pericarditis in case of rheumatic fever. Pericarditis in rheumatic fever has a pain, acute pain, very stabbing pain in one part. Angina pectoris is not having very acute pain. It spreads throughout the heart, chest. So there are some differences between these. And while acting on myocardium, which is the most dangerous act of rheumatic heart, that is, in case of myocardium, it produces, there are formation of some small granulomas in the blood, in the myocardium, layer of the myocardium, and these are known as Ashoff bodies. And this is very dangerous because it makes the myocardium very weak and flabby. We know that all the pumping is done from the myocardium, because it is a muscular layer. So in case of heart, when the muscular layer will not work, there will be no proper pumping. If there will be no proper pumping, there may be cases of heart failure. Sometimes Ashoff bodies spread into the pericardium, causes inflammation, spreads into the endocardium, causes inflammation. And in that case, when there is inflammation of all the three layers, this condition is known as pancarditis. One of the most serious complications in case of rheumatic heart. This is heart, the outermost layer, pericardium, the middle red layer, myocardium, the inner blue layer is endocardium. So it acts on pericardium and it increases the permeability. We will come to that, just a rough sketch, that increases the permeability of the pericardium. What happens when the permeability increases? We will come to that. In case of myocardium, it loosens the myocardium. There is loss of efficiency in the heart and there is congestive cardiac failure. And in case of endocardium, a most common complication of rheumatic heart, so there are formation of vegetations in the wall. You know, this is mitral valve. This is the left ventricle. In the left ventricle, there is mitral valve. In the endocardium, it produces valvulitis, it produces endocarditis, and due to this, you see, these are two valves. These are two valves, they move like this, and the heart is pumped from left ventricle to the aorta. So normally what happens, I told you that there is fever. So there is inflammation of the endocardium, there is fever. Due to fever, what happens? The pulse rate rises. So in case of 72, it becomes to 100, 110, like that. So in 1 minute, these valves are moving like this. So gradually what happens, when the speed is more, it gets injured from these two parts. So when there is injury to the mitral valve, gradually there is deposition of fibrous tissues in the part, and that causes vegetations on valve. And if there will be vegetation on valve, what will happen? We will come to that. These are the valve, the upper one, the lower one, aortic valve, and these are the vegetation. So when there is fibrosis of these parts, what will happen? There will be two things. One, if there is more vegetation, the opening will be narrowed down. The opening of the valve will narrow down, will come down. If it comes down, what will happen? Blood will not be pumped properly, so there will be mitral stenosis. Stenosis of mitral valve. Mitral valve gap will be reduced. And also, what will happen? That when the blood will be pumped here, it will not be pumped properly to the ventricle. When the ventricle will pump the blood here, it will not be pumped properly to the atrium. So some part will remain here and that part will be pumped later on to the ventricle. This condition is known as mitral regurgitation. Some part of the blood this should go out properly, remains here, then again it goes out. That condition is known as mitral regurgitation. And there will be distortion of valve. Due to this vegetation, there will be fibrosis of these parts. So when these corner parts will be fibrosed, the opening will be narrowed down and the opening will be distorted. The valves will be distorted. This is very important when you study a case of rheumatic fever. See, when I told you there is pericardium, the outermost layer, the pericardium. So when pericardium, action on pericardium. When the pericardium is acted by these antibodies, they increase the permeability of the pericardium. So normally pericardium is a layer which protects the heart. It doesn't allow certain substances to go, it doesn't allow to go out. But this permeability is increased. So there is increase in the fibrin deposits in the pericardium. These are the fibrin deposits. You can see. These are the fibrin deposits. This is the pericardium. We have opened the pericardium. So this is inner layer and this fibrinous strand of fibers like thread. So these thread-like deposits take place in the pericardium.
And because of this roughness, there is a friction rough.
So these are the fibrinous. This is known as bread and butter appearance, because you take two breads, apply a lot of butter and try to separate them. What will happen? If you separate two pieces of bread taken like this and try to separate it, when you will separate it, there will be strands of small thread-like structure. That is the structure present here. So it causes fibrin deposition, and this is known as bread and butter appearance. You can see these are this is bread and butter appearance. These are the appearances. So what will happen? If pericardium is there, heart's outer covering, and there is deposition of fibrin. So when the heart will beat, what will happen? Normally when the heart will beat, the pericardial layers, they do not scratch with each other. But when this will happen, the membrane of the pericardium, it will scratch with each other. So it will create a separate sound, then the heart sound. Because it is rubbing with each other, this rubbing is known as pericardial rub. When you will examine a patient, it is not essential that we will diagnose each and every case, but we can diagnose that this is abnormal. Because two layers of pericardium are rubbing each other, and please try to listen this sound. This sound is known as pericardial rub. You can hear with the stethoscope. This is not a regular sound of the heart, because regular sound is lup dup, but you will hear sound like this. Something is rubbing with each other. So this sound is known as pericardial rub. Now action on the myocardium, which I told you earlier also, that in case of myocardium, there are formation of Aschoff bodies. These are Aschoff bodies which act on the myocardium, produce inflammation of the myocardium, and they loosen out the myocardium. And if the myocardium is loosened out, what will happen? Myocardial texture. This is action of the Aschoff nodules. What happens after the action of the nodules? So the most important action is they make the myocardium soft and flabby. So if the myocardium becomes soft and flabby, what will happen? I told you, it will not contract properly. So if the myocardium will not contract, the heart will not function properly. heart will not function properly, so there may be congestive cardiac failure in severe cases. So death in case of rheumatic heart is only due to this cause. Otherwise, there is no death. There is problem, the patient suffers a lot, but death does not take place unless and until this complication is there. So there is pericardial involvement. I told you sometimes the pericardium is formed, there is inflammation, and there is immune cell accumulation. So the antibodies are going there. So there is accumulation of immune cells which disturb the normal harmony of the myocardium. So what does this cause? Rheumatic fever while acting on the valve. The most important action is on the endocardium and especially on the valve and especially on the mitral valve. The mitral valve is the valve which is greatly affected by the action in rheumatic fever. And mind it that there is no bacteria now. The bacterial stage is gone earlier. When the child was infected, bacterial infection was there, it got cured by itself or by medicines, but the complications remain. So these complications are non-bacterial complications. There is no formation of pus, less fever, but lot of complications. So these lot of complications are, I told you, thickening of valvular plates. I explained to you that the valve, they become thick. There is thickening of the valve and narrowing of the space, loss of translucency. There is formation of vegetation. I told you, see, these are valves and these are formation of vegetation. What like appearance? So these vegetations, they give load on the valve and the valvular space reduces. And after reduction of the space, there may be mitral stenosis, mitral regurgitation, and severe insufficiency of heart. Most affected heart is mitral valve. Sometimes aortic valve is also affected, but most common effect is on the aortic valve. You can see we will come to the point where what are the effects of valvular changes in rheumatic heart disease? What are the effects of mitral valve changes? So what are the changes which take place? So due to the distortion of the mitral valve, the shape of mitral valve gets disturbed. This is a disturbed mitral valve, which is looking like a mouth of the fish. You can see this is looking like mouth of a fish. These are the eyes and these are the mouth of the fish. So this appearance, this is nothing but mitral valve. This appearance is known as fish mouth appearance. And sometimes this looks like a buttonhole. We see the buttonhole, so it looks like the appearance looks like a buttonhole appearance. So these are the complications in case of mitral valve. The appearance becomes fish mouth. The appearance becomes buttonhole-like. There is mitral stenosis, which I already told. There is mitral insufficiency. And in the serious cases, there is calcific aortic stenosis. There is deposition of calcium in the aortic orifice and the aorta gets blocked. So you can imagine that lot of complications may arise due to these complications when we study a case of rheumatic heart. These are the real picture. These are the papillary muscles of the valve. These, you can see, these are the vegetation. This is the valve. And these beautiful picture shows you how are the vegetations present on the valve. And these vegetations disturb the total functioning of the mitral valve, creating so many problems. Though these cases are not very common, I have seen several cases of rheumatic heart, and in all these cases, I was not able to diagnose properly, but I was able to diagnose that the heart sound is not normal. So when you doubt that their heart sounds are not normal, there may be murmur, there will be friction sound, and the other symptoms are there. So when the other symptoms are there, then we should go for proper investigation of these two. And the best investigation, we will come to that, is echocardiogram. The echocardiogram is the best test which will diagnose the disfigurement in the valve, functioning of the heart, and other problems. You can see these are the vegetation on the valve. So clear. The valve की support, these are the support of valve, these are the valves, and these are the vegetation. You can see. These are the valves. And see, these are the vegetations. How these vegetation take place on the valve. Thickening of valve, opaque, inflamed, irregular border, shortening of chordae, tendino also change. These are chordae tendinae, they become short due to the load. There is formation of vegetations and which disturbs the total normal functioning of the cardiac system, especially the aortic valve. So I told you that what happens due to this, there is dysfunction of the mitral valve, and sometimes the blood which should not go back. Normally what happens? The blood should not go back to here. It will go to the system. Left ventricle pushes the blood into the system. It doesn't push the blood into atrium. I think I am clear. The left ventricle pushes the blood to the system, and when the left ventricle contracts, these valves should close. So the blood should not go from here to here. But when these valves get stiff, they get vegetation, their elasticity is lost, they get disfigured. So when pumping, some part of the blood goes into the atrium. And this is known as mitral regurgitation. And as this space has become narrow, this is known as mitral stenosis. You can see
atrium and the lower left heart chamber, left ventricle. A healthy mitral valve keeps your blood moving in the right
this is the
direction.
mitral valve, and the blood is moving from top to bottom, from atrium to ventricle.
A
Now,
leaky valve doesn't
you can
close
see.
the way it should, allowing some blood to flow backward into
Now
the left
some blood is
atrium.
going back
If
from
left
the
untreated,
atrium.
a leaky valve could
ventricle
lead
to
to
the-
heart failure.
So this is the condition which is known as mitral regurgitation. And if possible, I'll try to see the heart sound which comes in case of mitral stenosis. The sound is slow. This is the mitral stenosis, and the different sound will come in case of mitral. Very clear. Lupsh dup, lupsh dup, lupsh dup, lupsh dup. This is mitral regurgitation. So sometimes if you are aware of these things, so try to differentiate between these two sounds. Try to differentiate, understand what is happening in the heart, what is happening to the valve. You see very clear shape of a fish mouth valve. This is a normal valve. This is normal mitral, very smooth, completely nice. So this is a normal mitral valve, but after getting disruption from the disturbance of the endocarditis, rheumatic heart, the endocarditis, there is vegetation, and gradually these vegetations completely block the passage, and this becomes like a fish mouth. So thick, fibrous, scarred, stenic, and fixed with blood. This is a normal valve which is transparent, avascular, thin, flexible membrane. This membrane is very thin and flexible, but this is not thin. It is open, and there is distortion of the mitral valve. This will come in the test also. You can see what has happened. This is the mitral valve. Complete opening is blocked. There is fibrosis of these parts and there is mitral stenosis. In case of ultrasound also, you will be getting this.
Mitral stenosis in echo study. Into the echo, it is dome-shaped and thick,
You can see this shape.
but in
See.
3D echo, typical fish mouth appearance is clearly seen.
This is fish mouth.
Mitral stenosis in
This is
echo
fish mouth.
study. Into the echo, it is dome-shaped and thick, but in 3D echo, typical fish mouth appearance is clearly seen.
So these are the different important complications of the rheumatic heart when the relation to especially heart is concerned. So there are three main complications. One is action on the pericardium, where it causes pericarditis because there is deposition of fibrin inside the pericardium due to the increased permeability. So increased permeability causes distortion and gradually there is deposition of fibrin, which is known as bread and butter appearance. And it causes pericarditis, and due to pericarditis, there may be chest pain, there will be pericardial rub. The pericardial rubs with each other and it causes nothing. Next is the action on the myocardium. As I told you, there is formation of immune mediated granules, granulomas, small granulomas, which are known as Ashok bodies, which are present mostly in the myocardium. It disturbs the function of myocardium completely. Presence of more antibodies does not allow the myocardium to function and the myocardium becomes flabby, loose. It doesn't work properly. And if it will not work properly, the obvious result will be cardiac failure. A very serious complication, and this is only the cause of death in case of rheumatic heart. Normally, in case of rheumatic fever or rheumatic heart, there are complications, but there is no death. Except for this complication, and that also if the patient is not treated properly. In the villages, people are suffering, they do not know what is happening to the patient. So they will complain, the child gets cold and cough every 2 to 4 weeks, and then it gets all right, and the child gets all right. Sometimes the child complains of joint pain. So that joint pain also gets better by medication. So there is fever, there is severe joint pain, and all these complications goes automatically after a few weeks, but the cardiac complaint that remains. And what happens when this person is attacked by streptococcal infection? Often, very often, the cardiac complaints increase. The effect on heart increases because that is still there. That is not going back. The growth, the vegetations, the weakness of the valve, the distortion of the valve, it is remaining there. So if it is remaining there, you cannot help. And the condition will deteriorate. So endocardium, the most important part, where it acts on the valve, and valve gets distorted. There is fish mouth stenosis. There is stenosis because of the vegetation, the valve becomes narrow, so there will be stenosis. When it will not function properly, not open properly, then some part of the blood may rush from the left ventricle to the aorta, which is not the proper pathway for it. So this causes mitral regurgitation. So in case of rheumatic heart, you will get all two complications. One is mitral stenosis, second is mitral regurgitation. Now come to the other complications that we discussed. The cardiac part is over. The cardiac complications are over, cardiac symptoms are over. There may be pericarditis. I told you regularly that there will be pericarditis, and that is the symptom you will get. There is severe pain in the chest. stabbing, severe localized pain in the chest, and the patient will try to hold the chest. And we know what is the best medicine. Patient tries to hold the chest, avoid the movement, feels better by stooping forward. The best medicine is Bryonia. When the action is on muscular layer, myocardium, the best medicine is Arnica. Arnica is working only on the muscles specially. So when there is pain, there is a loosening of the muscles, there is the best medicine is Arnica. We will discuss the medicine part in the second lecture, so complete detail of the medical part. So this chorea symptoms when it acts on the brain. So when it acts on the brain, I discussed that it releases some cytokines, some chemicals, which disturb the motor reflexes in the brain. So due to its effect on the brain, the motor reflexes are disturbed and there is involuntary movement of the body, especially arms and legs. Involuntary jerky movements like epilepsy. There is involuntary jerky movements of the child. Child will move like this and beyond his control. He can't control this. And this, but fortunately, this Sednam chorea, if it is persisting, it gets cured automatically. If you give medicine, well and good. If you don't give medicine, it gets cured within a few weeks. It does not reappear. The reappearance is only in the cardiac side. Reappearance is only in the fever side. Fever may reappear, joint pain may reappear after 6 to 12 years after the attack of rheumatic fever. If the rheumatic fever is continuing, and this may appear even after 6 to 12 weeks, the patient gets a streptococcal infection, throat infection, gets normal, there is no issue, there is no problem. But after 6 to 12 weeks, the patient will come, the parent will come that he was having fever, we didn't care, he became all right, but now suddenly he has started this involuntary movement. Clinically manifested as clumsiness, deterioration of handwriting, a grimacing of face. He will make faces like this. Involuntary movement of the face. You can see, I will show you a patient of Sednam's chorea. He has no control. Completely involuntary movement, jerking movement. See, there is complete involuntary jerky movement of the system, the body, the hand, the legs. The child is not able to control. And this is the case after an attack of rheumatic fever. This is the complication after an attack of rheumatic fever when it goes to the brain. When the antibody goes to the brain. Next complication is action under the skin. So I told you that under the skin there are subcutaneous tissues, and in case of subcutaneous tissue, it goes there and produces fibrosis. And there are some formation of some nodules, especially on the extensor side. See, occurs in 10% of these cases. They are painless, pea-sized, palpable nodules. So the visible nodules mainly over extensor surfaces of the joint, spine and scapula and scalp. So mostly it is on the hand and above the spine. These are the two very common areas where you will find the nodules. And if you will treat the patient, these nodules will be dissolved. You don't need to do much because it goes automatically. Always associated with severe carditis. I told you that the most complicated and most dangerous complication in case of rheumatic heart or rheumatic fever is carditis. If the patient is not suffering from carditis, you can be rest assured that the patient will be all right. But if it is having some carditic symptoms, which you will get after the checkup, proper checkup, these are the nodules. You can see these kind of subcutaneous nodules are forming, which dissolve automatically. These are fibrous tissues. So when the patient gets better, after some weeks, these nodules gets better and the patient becomes normal. There are no further complications in case of subcutaneous nodules. So we discussed one complication, action on the nervous system, and which was D.H.M.S chorea. Second is action on the subcutaneous tissues causing nodules. Next is erythema marginate. So there are skin rashes. Unique, transient, they're pigmentous looking lesions of 1 to 2 inches in size. Pale center, red irregular margin. The outer side will be red and the middle will be pale. It will look like a ringworm. If you normally see in the practice life, it will be looking like a ringworm, but the other test will be positive for rheumatic heart or rheumatic fever. More on the trunks and limbs and non-itching. The ringworms are very itchy. Whenever we study the ringworms are having severe itching, but these rashes don't get any itching. So please go for the history. If the patient says that he was having some fever, some history of pharyngitis or throat infections, it gets worse on application of heat and often associated with chronic carditis. You can see in all complications, erythema marginatum, erythema nodosum, all in these cases, you got that it may be associated with carditis. You can see these kind of rashes. The outer part is red, the middle part is pale. This is erythema marginatum fungi. And every time if you will see this kind of case, please talk to the patient, talk to the parent, get the history that he is recurrently getting throat infection. Clear cut, round eruptions, middle pale, and these are the red. And they diminish automatically. After some weeks, they diminish automatically. Patient is not having itching, so there is no problem. In case of ringworm, they look like same, but they have severe itching. And this complication, which will help you in diagnosing the case properly, that is arthritis. There are two words. One is arthritis, one is arthralgia. Normally we think that both are same, but both are not the same. Arthritis is when there is inflammation, when there is swelling, when there may be fever. These symptoms in total will be called arthritis, pain in the joint. Artha means joint. Itis means inflammation. So there is inflammation of joints, there is pain, there is swelling, there is loss of function. That is arthritis. And if there is pain in the joint, that is arthralgia. In maximum cases of arthralgia, when there is pain in the joint, you will not get swelling. Patient will complain, oh, I am getting pain in the joint, you see, but there will be no swelling. This pain will be due to rheumatic pains, gouty pains, or osteoarthritic pains and other things. As this belongs to a case of children. So in case of children, small children, You will always get patient with severe swelling in the joints, severe pain in the joints, to see how much the joint has swollen up. So there is a serious swelling of the joint, and this joint pain, and the characteristic of this joint pain in case of rheumatic fever is that they are shifting in nature. The pain, the swelling, they are shifting in nature, sometimes mostly in the knee joint, sometimes ankle joint, sometimes elbow, sometimes hand, sometimes others.
Excuse me, sir, only 8 minutes remaining.
Pardon?
Only 8 minutes remaining, sir.
Yes, yes, we are finishing. We are on the end. So this swelling is shifting in nature, migratory, written migratory arthritis. So migratory arthritis, when the pain shifts from one point to another joint. Abrotenum, pulsatilla, best medicines for migratory arthritis kind of. So there is a diagnostic criteria. This is the last slide. So there is a diagnostic criteria for diagnosing a case of rheumatic fever. Dr. D.H.M.S, it has made a diagnostic criteria which is known as the Jones criteria. So there are two criteria. One is major, one is minor. So major criteria is the 5 cardinal signs. You can remember cases: carditis, arthritis, subcutaneous nodules, erythema marginatum, Sydenham's chorea. So these are the 5 most important major criteria. And there are minor criteria, which is known as FRAP: fever, raised ESR, arthralgia, prolonged PR interval, and previous history of rheumatic fever. So these are the minor criteria: 1 major, 2 major, or 1 minor. Sorry, 1 major and 2 minor can be the criteria, and 2 major only can be the criteria. Nowadays, they have added some more criteria, that is ASO titer positive. There is a blood test which is known as ASO titer. That should be positive. ESR should be positive. RA test should be positive. So they have added like this. The third, this is known as the third criteria, added criteria with the Jones criteria for diagnosing a case of rheumatic fever. Now, mainly these 5 are the most important part. These are the cardinal part: cases, carditis, arthritis, subcutaneous nodules, erythema marginatum, and Sydenham's chorea. 2 of the major, or 1 major, or 2 minor. If these are present, this will be known as proper case of rheumatic fever. So in the next lecture, we will discuss the diagnostic points and the homeopathic management of rheumatic fever, complete with medicines and all that. That will be on 11th of March. I will be having the second lecture. So I hope you understand, and if you have any questions, you can please ask.
Yes, only 5 minutes remaining. As an extensive topic, I beautifully narrated, absolutely a professional one. Time for discussion. Those who would like to participate, please raise your hand. 5 minutes remaining. Yes, please. As sir rightly mentioned about this, the major manifestations, the chorea, arthritis, then erythema nodosum, erythema, then carditis. These are the major manifestations. So we are very much conversant about every person in medical science is always conversant about conditions, but only a few therapeutic modalities can be conversant about medicines. But Vindyanil, what is your opinion?
I couldn't follow that.
Yes, sir. Yes, Dr. Vindyanil.
Yeah, thank you, sir. Yeah, actually, sir, only a small question. I have a few questions for therapeutics, but I will ask them for sir's in next lecture. He's going to cover that.
Yes, yes.
Okay.
We will
Yeah, sure, I'll go for that.
Don't worry.
Yeah. Sir, but
Same.
Yeah. But related to this lecture, only one query was this. Can you explain us the role of the nosode streptococci for using during in these rheumatic fever cases?
You see,
Because it is a post-streptococcal infection.
streptococcin is one medicine. There are some other medicines also, nosodes.
Surely there, but it's a nosode. It's a, like we can say, prepared for organism, we can say.
Organism, but the thing is that the bacterial infection is only related with the throat.
Yeah.
The rest of the complications are not due to the bacteria.
Yeah. They're post-streptococcal. But in
Yeah.
such cases, when we receive them, should we give
I
them
have-
as at the beginning of treatment?
You will be discussing, reading now that the penicillin is the best medicine.
Yeah.
The penicillin is given in these cases for years together.
Crystalline penicillin, it was given in back days.
So homeopathic penicillin, streptococcin, both work very nicely in these cases.
Okay.
I have been using penicillin in plenty cases.
Okay, so we should think of them before in the handling such cases. Okay,
Yes.
so yeah. Thank you, sir. Yeah.
Yes, if anybody would like to participate. Yes, Dr. Danesh, you can make the conclusion as well as vote of thanks, yes, please.
As usual, our respected KULWANT Singh sir came to this platform and made a beautiful presentation. As we know, rheumatoid arthritis as well as rheumatoid heart diseases are common nowadays. We are still have the difficulty in differentiating all these diseases, particularly diagnosing each. But sir has beautifully mentioned about each and every part of the disease progress and how it can be diagnosed and everything. But more thing will come in the second part, I think.
Yes.
And definitely the Materia Medica part also will,
Yes.
sir is a person who always share his experience with those diseases. That is what we are looking at also, that being a very, very important part of our next session. Usually, we are getting a lot of arthritis or rheumatoid cases treated by the rheumatologist as well as cardiologist. And we may find a little bit difficulty whether to stop the allopathic medicine all of a sudden or whether we will have to go with our medicine. What's your opinion on that, sir?
Sir, just for reference, my next lecture will be on rheumatoid arthritis.
Yes.
That is in the Hindi we are having in the month of June.
Yes.
That
Yes.
will cover all aspects of arthritis.
Okay, sir. Definitely, we are waiting anxiously and waiting for such a session on the 11th. Anyway, I am saying the thanks to you on behalf of International Forum for Promoting Homeopathy as well as on my behalf, sir.
Thank you all. Thank you.
Yes, thank you, Dr. Danesh. And what is most remarkable is that KULWANT sir is an experienced person and he is still ready to exchange his views with the other persons. That is more important. The promotion of homeopathy is doing through IFPH is also, we are all intending for that. So with that remark, let me conclude today's English edition. Hope you that will be back again tomorrow. Till then, goodbye. And Dr. Mariama John to continue the program in Malayalam. Thank you.